Dr. Ruth Roberts is a talented and compassionate veterinarian. Dr. Roberts knew at an early age that she wanted to help animals.
Everybody that's had a pet as a child, or at least most people I talk to, have said kind of the same thing, in that the pet becomes their confident and trusted friend. Out of that relationship came the desire to be able to help them.
Upon graduation from vet school, Dr. Roberts started working at a mixed practice.
The first job I had actually was also on Johns Island, and it was in a mixed practice. So we took care of horses and then pets, dogs and cats, and then part-time as well downtown at a practice that also took care of some of the carriage horses.
Dr. Roberts started expanding her medical knowledge to push the limits of Western medicine as far as diagnosis and treatment.
I went through the education process for certification for American Board of Veterinary Practitioners. And what that did was really bring up my game and my ability to diagnose and treat disease on the Western side.
Her desire to dive deeper into the options for diagnostics and treatment led her to the exploration of Eastern and alternative medicine.
Alternative medicine became an important part of the picture for me once I'd gone through that process of really re-educating myself and bringing myself up to speed on sort of the latest diagnostics and diseases and all of that. And I realized in many cases we could make a diagnosis, but often we couldn't do anything for these guys. We would put them, most of the time it was on drugs like prednisone or non-steroidal drugs for arthritis, things of that nature. And while it may help for a while, we still weren't getting at the root of the disease. So alternative medicine, and traditional Chinese medicine in particular, offers an opportunity to treat the roots of the disease rather than the branches or the symptoms. What I'm doing is practicing integrative medicine, where we integrate as many techniques or modalities as are necessary to help that patient. Here's the Western way to handle this issue, and then here's the TCM way, the traditional Chinese medicine way, and then here's a nutritional component, and then here's Western herbology, and here's homeopathy. The trick is to go through in my head quietly what are the options available and what options are going to be most likely to be successful for that pet.